I'm the subject module lead for Prevention and Healthcare Delivery, the PhD module. It's a threaded module that goes through particularly years 1 and 2 and is going to give all of our students really the wider context to what's going on in health. So it's going to help them understand how we essentially bring knowledge about the wider circumstances patients live in, so inequalities, the wider determinants of health and how that comes into the care of patients, but also around how we handle evidence effectively, how the NHS is structured, and I guess anticipating many of the students' future roles as medical leaders, how they'll get involved in wider shaping of the way we do health in the future. I think that you're always learning. There's been a surprise. When I started in my career, I worked as an anaesthetist and I would never anticipated that I would end up in public health. So actually there's a wonderful learning journey that happens in medicine where you work alongside colleagues and you get to know patients and communities, and actually that really shapes who you become. So I think there's something about being up for the adventure actually of what it is to study medicine and to really see where that takes you. The joy of being part of a medical degree is you get to try all of those things and you get to understand how they all fit together, and it's that wonderful space where you see all of that. And then as your career develops, you then get the excitement actually of really building your specialist expertise. So I think more than anything, being open to learning and just seeing where that takes you. It's easy to jump straight to all of the amazing natural resources, but actually I would start by saying that the course and the way and the place that it is delivered, I think, is something really exciting, particularly for these first cohorts of students as they begin to come through. Actually, tomorrow's doctors have a responsibility to understand the way that people grow up in places, and those places shape their health, and the communities that they grow up in shape their health. And so the way the course is designed here, I think, is a really interesting and novel way of discovering that context, and that will mean that people who train through the University of Cumbria will have this incredible opportunity to be nimble to the way that healthcare is being shaped in the future. So, and there is a fantastic range of challenge and need. We have post-industrial communities, we have student communities, we have isolated rural communities. All of those have different healthcare needs. So I think the first advantage to studying here is actually understanding that breadth and getting to develop your practice in really different and sometimes quite challenging contexts, but where actually the opportunity to have an impact is also massive. This is an area that has historically kind of had less doctors, and therefore actually for each of these individual students there's a chance for them to come and actually really make their mark and actually be part of shaping healthcare and becoming part of the learning community in the future. And on top of that, it is a beautiful part of the world to live. It's got some great cultural resources, it's got some incredible natural resources as well, and those will always occupy your spare time around everything else as well. The students I think that will flourish most on this course are those that are interested in understanding how place and community impacts on people, and also who really understand or want to get to know the story of this part of the world and to understand where people are coming from. You obviously just need to be a keen and curious learner actually. I think that's the most important thing. There's always factual knowledge you need to pick up, but actually it's that wider, I guess, learning the way of doing medicine and the art and the practice of medicine and bringing that together with your scientific background that is going to be most important. So I think actually what I'm hoping for is a wide range of people actually to come and study. One of the real privileges of medicine is you work alongside people from an incredible range of backgrounds, an incredible set of skills, and actually it will be really exciting. One of the things I'm looking forward to as a sort of a subject module lead is to see how actually the cohorts of students begin to share and develop together. Everyone's already bringing specialist expertise, specialist knowledge, the training they've already done, their experiences, their personal stories. And actually it will be the blend of all of that that makes the course more exciting as we sort of put those experiences together into kind of the learning journey that we go on. I think it's an opportunity to take my passion for population and public health and the way we think about healthcare and land it right into the heart of the development of clinical skills and future doctors. We need tomorrow's leaders to really grasp some of the challenges that still remain undone. We see huge differences in health inequalities. As you travel around this area, the life expectancy of the communities that you go past will change by more than sort of 10, 15 years in some examples between local places. I'm most excited to participate because I think the course is set up to give our future medics an opportunity to understand that and to bring that right into the heart of every patient contact that they have. And I think getting to see the impact and the effects of that, and actually begin to see us shifting some of those stubborn population health outcomes that have been unfair and unjust and unaddressed for far too long. I think if we see a little bit of that and see the students that come through PCSM doing that, that will be the most exciting outcome for me.